Venous thrombosis or venous thromboembolism, VTE, is called blood clot that starts in a vein. Two types: deep vein thrombosis and pulmonary embolism. Risk factors: hip knee replacement, hip knee replacement, hip knee replacement. Heart failure, heart failure, heart failure. Immobility, immobility, immobility. Pregnancy, pregnancy, pregnancy. Combined oral contraceptives, combined oral contraceptives, combined oral contraceptives. Family history, family history, family history. African Americans, African Americans, African Americans. Signs and symptoms: calf thigh pain, calf thigh pain, calf thigh pain. Edema, edema, edema. Erythema, 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 erythema. PE, shortness of breath, shortness of breath, shortness of breath, shortness of breath. Dyspnea, 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 dyspnea. Anxiety and chest pain with inspiration, anxiety and chest pain with inspiration, anxiety and chest pain with inspiration. Tachycardia, tachypnea, hypotension. Tachycardia, tachypnea, hypotension. Tachycardia, tachypnea, hypotension. Procedures: thrombectomy, removal of the clot. Inferior vena cava filter prevents new emboli from entering the lungs. Nursing considerations: DVT, elevate extremity, no pillow or knee gatch under knee. Elevate extremity, no pillow or knee gatch under knee. Elevate extremity, no pillow or knee gatch under knee. Warm, moist compresses, warm, moist compresses, warm, moist compresses. Do not massage limb, do not massage limb, do not massage limb. Apply compression stockings, apply compression stockings, apply compression stockings. Monitor for SS or PE. Monitor for signs and symptoms of PE. Monitor for signs and symptoms of PE. PE, sit patient upright, high fowlers. Sit patient upright, high fowlers. Sit patient upright, high fowlers. Administer oxygen as ordered. Administer oxygen as ordered. Administer oxygen as ordered. Venous insufficiency. Veins in the lower extremities do not support blood back to the heart effectively. Risk factors: obesity, immobility. Obesity, immobility. Obesity, immobility. Pregnancy, history of DVT. Pregnancy, history of DVT. Pregnancy, history of DVT. Signs and symptoms: edema, aching pain in legs. Edema, aching pain in legs. Edema, aching pain in legs. Venous stasis ulcers. Venous stasis ulcers. Venous stasis ulcers. Heavily draining around the ankles. Heavily draining around the ankles. heavily draining around the ankles. Brown discoloration of legs. Brown discoloration of legs. Brown discoloration of legs, which is stasis dermatitis. Stasis dermatitis. Stasis dermatitis. Treatment: elevate legs for venous return. Apply compression stockings. Monitor for complications. Patient teaching: avoid sitting and standing for too long. Avoid sitting and standing for too long. Avoid sitting and standing for too long. Change positions often. Change positions often. Change positions often. Avoid crossing legs and restrictive pants. Avoid crossing legs and restrictive pants. Avoid crossing legs and restrictive pants. Apply compression stockings before getting out of bed in the morning. Apply compression stockings before getting out of bed in the morning. Apply compression stockings before getting out of bed in the morning. Okay, next we're going to go on to hypertension, which is high blood pressure. Primary, most common idiopathic. Primary, most common idiopathic. Primary, most common idiopathic. Secondary, disease or medication causes increase in blood pressure. Secondary, disease or medication causes an increase in blood pressure. Secondary, disease or medication causes an increase in blood pressure. Risk factors. Primary, family history, family history, family history. Increase in sodium intake, increase in sodium intake, increase in sodium intake. Obesity, obesity, obesity. Smoking, smoking, smoking. Stress, stress, stress. Hyperlipidemia, hyperlipidemia, hyperlipidemia. Secondary risk factors: kidney disease, kidney disease, kidney disease. Hypothyroidism, hypothyroidism, hypothyroidism. Cushing syndrome, Cushing syndrome, Cushing syndrome. Pheochromocytoma, 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 pheochromocytoma. Next, we're going to go on to varicose veins. Dilated, tortuous veins full of twists and turns. Risk factor: female, female, female. Prolonged standing, prolonged standing, prolonged standing. Pregnancy, pregnancy, pregnancy. Obesity, obesity, obesity. Family history, family history, family history. Signs and symptoms: distended rope-like veins in the calves, distended rope-like veins in the calves, distended rope-like veins in the calves. Aching pain and feeling of heaviness in legs, aching pain and feeling of heaviness in the legs, aching pain and feeling of heaviness in the legs. Edema pleuritis, edema pleuritis, edema pleuritis. Treatments: compression stockings, compression stockings, compression stockings. Elevation, 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 sclerotherapy, 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 vein stripping, removal, vein stripping, removal, vein stripping, removal, radio frequency and laser treatment, radio frequency and laser treatment, radio frequency and radio frequency and laser treatment. Cardiomyopathy. Risk factors. Genetics. Coronary artery disease. Coronary artery disease. CAD. Diabetes. Aortic stenosis. Hypertension. Viral infections. Alcohol drug use. Signs and symptoms. Shortness of breath. Fatigue. Dizziness. Edema. Arrhythmias. Murmurs. Diagnosis: echocardiogram, coronary angiogram, EKG. Treatment: medications, digoxin, diuretics, antidysrhythmics, and antihypertensive medications. Surgery: septal myectomy, septal ablation, implanted devices, CRT, ICD, LVAD, pacemaker, heart transplant. Just information purposes. What you're going to really want is to make sure that you get the risk factors and the signs and the symptoms, because that's what's going to come on those tests, and that's what sneaks up on you. Coagulation disorders. Impaired clotting due to a deficiency in platelets and or clotting factors. Signs and symptoms: excessive bleeding and bruising. Excessive bleeding and bruising. Excessive bleeding and bruising. Oozing of blood from incisions. Oozing of blood from incisions. Oozing of blood from incisions. Petechiae, tachycardia, hypotension. Petechiae, tachycardia, hypotension. Petechiae, tachycardia, hypotension. Treatment: blood products, fluid volume replacement, oxygen, clotting factor replacement. Nursing care: limit veni punctures and IM injections. Limit veni punctures and IM injections. Limit veni punctures and IM injections. Implement fall precautions. Implement fall precautions. Implement fall precautions. Patient teaching: use soft bristled toothbrush. Use soft bristled toothbrush. Use soft bristle toothbrush. Use electric razor. Use electric razor. Use electric razor. Avoid blowing nose forcefully. Avoid blowing nose forcefully. Avoid blowing nose forcefully. Seek immediate medical attention following any head trauma. Seek immediate medical attention following any head trauma. Seek immediate medical attention following any head trauma. Acquired coagulation disorders. We just completed coagulation disorders. This is acquired coagulation disorders. It's an autoimmune disorder possibly triggered by a viral infection, causes a decrease in the lifespan of platelets. So, for HIT, immune-mediated drug reaction that causes a drop in platelets after heparin treatment. HIP, an immune-mediated drug reaction that causes a drop in platelets after heparin treatment. HIT, an immune-mediated drug reaction that causes a drop in platelets after heparin treatment. Treatment for HIT: stop heparin immediately, administer alternative anticoagulant, which can be argatroban, platelet transfusion. Treatment: stop heparin immediately. Stop heparin immediately. Stop heparin immediately. Causes a drop in platelets after heparin treatment. Okay, I did it right. We'll go on now. ITP, an autoimmune disorder possibly triggered by a viral infection, causes a decrease in the lifespan of platelets. We are now going to go on to ITP, which is an acquired coagulation disorder. We just did HIT. ITP is an autoimmune disorder possibly triggered by a viral infection, causes a decrease in the lifespan of platelets. Treatments: corticosteroids, 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 IVIG, IV immunoglobulin, IVIG, IV immunoglobulin, IVIG, IV immunoglobulin. Okay, I butchered globulin. Splenectomy, splenectomy, splenectomy. The next acquired coagulation disorder is DIC. This is a disorder where clotting factors and platelets are depleted through formation of thousands of microclots in the body. Most common cause is severe sepsis. Treatment: platelet plasma transfusion. Platelet plasma transfusion. Platelet plasma transfusion. Heparin, heparin, heparin. Sinus dysrhythmias, sinus tachycardia, regular cardiac rhythm, heart rate of 100 beats per minute, causes physical activity, anxiety, fever, pain, anemia, medications, compensation for lower cardiac output or BP. For treatment, treat the underlying cause. Sinus tachycardia, regular cardiac rhythm, regular cardiac rhythm, regular cardiac rhythm. Heart rate equals to 100 BPs. Heart rate equals to 100 BPMs. Heart rate equals to 100 BPMs. Sinus bradycardia, another sinus dysrhythmia. Regular cardiac rhythm, regular cardiac rhythm, regular cardiac rhythm. Heart rate equals to 60 BPM. Heart rate equals to 60 BPM. Heart rate equals to 60 BPM. It's a normal expected finding in athletes. For treatments of sinus bradycardia, treatment of asymptomatic bradycardia is not necessary. Treatment for asymptomatic bradycardia is not necessary. Treatment for asymptomatic bradycardia is not necessary. Atropine or pacemaker for symptomatic bradycardia. Atropine or pacemaker for symptomatic bradycardia. Atropine or pacemaker for symptomatic bradycardia. Sinus arrhythmia. Normal variant from normal sinus rhythm where the heart rate increases slightly with inspiration and decreases slightly with expiration. Treatment is not necessary. Atrial dysrhythmias. Atrial fibrillation, AFib, is a rapid and disorganized depolarization of the atria, causing the atria to quiver or fibrillate instead of fully squeezing. This causes this causes blood to collect in the atria, placing the patient at high risk for clots. Treatments: cardioversion, antiarrhythmics, anticoagulants. Treatments: cardioversion, antiarrhythmics, anticoagulants. Treatments: cardioversion, antiarrhythmias, anticoagulants. Another atrial dysrhythmia is atrial flutter. Abnormal electrical circuit forms in the atria, causing the atria to depolarize 250 to 350 times a minute. Treatment: cardioversion, antiarrhythmics. Treatment: cardioversion, antiarrhythmics. Treatments: cardioversion, antiarrhythmics. The next atrial dysrhythmia is premature atrial complex, otherwise known as PAC. Abnormal impulse that originates from the atria and occurs early. Treatment: not necessarily usual. Avoid stress, avoid stress, avoid stress. Avoid alcohol and caffeine. Avoid alcohol and caffeine. Avoid alcohol and caffeine. And supraventricular tachycardia, otherwise known as SVT, is an abnormally fast heart rate that originates above the ventricles, typically in the atria. Treatment: cardioversion, antiarrhythmics. Treatments: cardioversion, antiarrhythmics. Treatments: cardioversion, antiarrhythmics.